Welcome, everyone. We are going to get started in just a couple minutes here. If you are trying to join the session, Socially Connected Communities, Equity Solutions to Social Inclusion, you are in the right place. My name is Will Crary. I am an Associate Program Manager at Prevention Institute. I'm joined by my colleague, Zach Taro, who is running the behind the scenes, and we simply could not do it without Zach's support. And I see some more people coming into the session. We got some folks joining. Our waiting room was filling up, so we're so glad that you could join. And again, just for anyone just joining us, this is the Socially Connected Communities, Equity Solutions to Social Inclusion workshop. And I hope that day one of the Young Minds Matter conference has been enjoyable and compelling for you all so far. Again, my name is Will Crary. I'm an Associate Program Manager at Prevention Institute, joined by my colleague, Zach Taro. And while we wait for some more people to join us, I invite you to drop your name and maybe your organization and where you are joining us from in the chat. And something else that I thought could be a good way to kick this off is just to share in the chat with us, and I will add this question: what does social inclusion mean to you, and what brought you to this session? So we want to make this an engaging session, so we're going to be throwing some questions out there and all that good stuff. Let's see if we have any brave souls responding in the chat. Oh my goodness. All right, we still have lots of people joining. Very exciting. So thank you if you're just joining us. In the chat, we're asking, what does social inclusion mean to you, and what brought you to this session? And as folks are responding to that, I just, you're probably familiar at this point with some of our housekeeping items. Again, my name is Will Crary. I will be moderating this session. I am not your presenter. Your presenter will get an illustrious introduction shortly. But I just wanted to remind everyone that this is a safe, a brave, a courageous, supportive space. And what we mean by that is we want to maintain a respectful and inclusive environment. And so we're excited for you all to join and engage in the conversation in a way that builds our connection and respect for one another. And because the audience members today are muted, we ask that you please use the chat function in Whova to interact with other attendees. And so if you have any questions, you can also use the Q&A function. And if anyone is having issues with tech or joining over Zoom, please just let us know in the chat. And we can also share the Zoom link so that you can join that way. But be sure to just continue using the chat function in Whova. And lastly, I'm going to share a couple forms that we ask that you all fill out. One is for everyone, and we're just asking that you fill this in. It's a general sign-in sheet, and it just takes about 15 seconds to let us know you're here. And the second one is for any of you interested in CEU credit, or I guess that's redundant, credits for continuing education units. So you can fill that out. And I think we're getting some good responses in the chat here of what social inclusion means to different folks, honoring people's voices, feeling like you're part of something. Yeah, absolutely. And so I think we're going to get an opportunity to hear more about that. So without further ado, please join me in welcoming our presenter for today, one of my dearest colleagues, Ruben Cantu. And Ruben, I see you've unmuted yourself. I was hoping to take this opportunity to embarrass you for a second and read your bio so everyone knows a little bit more about you. So Ruben is an associate program director on Prevention Institute's safety and well-being team, and he has more than 20 years of nonprofit experience in public health, mental health, and well-being work through an equity and racial justice lens. At Prevention Institute, Ruben leads initiatives to address and prevent community trauma through application of Prevention Institute's adverse community experiences and resilience framework. He also works on strategies to improve mental health and well-being through a focus on community conditions. And I would be remiss if I did not share that Ruben is the author of California's Strategic Plan for Reducing Mental Health Disparities and serves on several state advisory committees. So we are so grateful and honored that Ruben can share his wisdom and insights with us. And without further ado, I will pass it over to Ruben.
Thank you, Will, and thanks, Zach, for supporting and making sure that this session goes well. I'm really excited and honored to be part of the lineup of presentations for Young Minds Matter 2021. It's exciting, it's momentous, it's very important for those of us that work at Prevention Institute that this conference bring together the folks that it brings together to have the conversations that we're having, all very important in improving and addressing mental health and well-being and equity and racial justice. So really excited to share with you all a little bit about some of the emerging work that we're doing around social connection as a way to counter social isolation, and sharing some of the solutions and strategies that we've been able to collect over the last couple of years. Next slide. Just to share a little bit, I think most folks are familiar with and have heard about Prevention Institute through your work and through the course of the conference today. As you know, Prevention Institute, we're a national nonprofit organization that's been around for over 20 years, working to advance the practice of primary prevention, preventing illness and injury before it has a chance to occur, and making sure that prevention is really strongly embedded into policies and practice so that we can have healthy, equitable outcomes for everybody. This is just a snapshot of our office in Oakland. We also have an office in Los Angeles and Houston and Washington, DC. Next slide. So kind of to ground us a little bit in this conversation, thinking back to the first couple of months of 2020, we were starting to hear about this COVID-19 pandemic, and people, you know, it was a moment of a lot of uncertainty around that and what that actually meant. We were starting to see an uptick, or we were starting to hear more about an uptick in racially motivated violence that's actually been around for a very, very long time. But it was starting to really gather a lot of mainstream attention. And that was something that was also kind of percolating under the surface and very soon was about to erupt at the same time as the pandemic was. We were starting to see an increase in racially motivated violence, not only the killing of unarmed Black men, but also racially motivated violence against Asian and Pacific Islander communities related to the pandemic. We were starting to feel pressure around an economic downturn that was sure to come because of the pandemic. And in the midst of all of that, we were seeing an increase in the kinds of adverse climate events that were impacting people across the country, from wildfires all up and down the West Coast, hurricanes in the Gulf Coast region and along the East Coast, tornadoes and other things in the Midwest of the country. And all of that was leading folks to kind of start feeling this sense of overwhelm. And it's easy to see why. There was so much going on around us. In the midst of all of this, with the pandemic and a shift for folks that were able to work from home, having to manage being at home with family sometimes, having to make sure that children we might have are attending classes, just so much going on. But at the same time, we saw people starting to work towards solutions and strategies that were giving us a little bit of a glimmer of hope. Next slide. And here we are now in 2021, you know, kind of feeling the mental toll of a year and a half of the pandemic. And there's still a sense of continual uncertainty with this. You know, the Delta variant kind of threw things into a little bit of a confusing moment earlier this year. But at the same time, we're also starting to see solidarity in the face of this racially motivated violence. We're starting to see more people stand up against it, having marches, coming together, and recognizing that a lot of that is rooted in historical policies and practices that excluded people from opportunity. And we're also starting to see people talk about having an equitable recovery from the pandemic instead of just talking about a return to normal, because we also know and recognize that normal was not something that was working for a lot of people to begin with. And the pandemic really helped us see those inequities a little bit more clearly. And most importantly, we're starting to see a window of opportunity for us to try to make really substantive change in our communities to improve health and safety outcomes. So all that is kind of a preface to where I want to go with talking about social isolation and social connectedness. Next slide. And one of the things that we've seen an increase of during the pandemic, you know, not to say that this wasn't around for many, many years and people were dealing with this for many years, is an increase in that social isolation. And on the slide here, I'm just kind of putting out some definitions on social isolation and loneliness and what the difference between those are. But really, social isolation is that state in which individuals lack a sense of belonging socially, lacking engagement with others, having a minimal number of social contacts, where they are deficient in having and maintaining those fulfilling and quality relationships. And next slide. It's a point I want to make that evidence is pointing to the fact that a significant portion of the American population is socially disconnected in some way. And again, this predates the pandemic. We were starting to see an increase in social isolation among certain populations. We often heard people talking about it in terms of older adults and seniors, LGBTQ populations, immigrants and refugees, who lacked the opportunity to connect with other folks in their community in a meaningful way so that they could feel part of a bigger whole. And we also recognize through research that being able to be connected to others is such a health promoting practice. There are studies out there, and when we share the link to the report in the chat a little bit later, you'll be able to see, like, there are studies that show that being socially isolated is just as big, has just as big an impact on people's health and safety and well-being as, you know, smoking a pack or two of cigarettes a day. It is a really huge thing that has gone unrecognized by a lot of folks. And it's also one of those things that the pandemic has really helped to illuminate for a lot of folks. Next slide. You know, just sharing a little bit of research that's been coming out lately. And this is from the AARP Foundation. More than 7 in 10 adults agree that the pandemic has made it more difficult for them to connect with friends. And just let that sit for a second. Next slide. Another bit of data from the AARP Foundation. Since the pandemic, 2/3 of adults report having experienced social isolation, and around the same amount also report that a loved one has experienced social isolation as well. The pandemic has really helped to exacerbate a lot of the isolation and disconnectedness that people have been facing, especially for those folks, like I mentioned, older adults, LGBTQ populations, immigrants, and refugees. It's become a really, really difficult time. Next slide. And we're also recognizing where a lot of those barriers to connection are coming from. Things like transportation issues, long-term illness is a definite barrier here. Broadband access. I know during the pandemic, it was easy for me to set up Zoom conversations with friends that I hadn't been able to connect with in person. But for folks that don't have that kind of broadband access, it's impossible to kind of do that. Lack of safe public spaces, dealing with disabilities, long-term illness, all these are things that are barriers to keeping folks from engaging with other folks. Next slide. Just a quick question I want to pose to folks to see if anybody has anything they'd like to drop in the chat. In your community, what do you see as the barriers to engaging others, particularly during this time, when there's still a lot of uncertainty around the pandemic? What is keeping folks from being able to engage with others in your community? And let's take a second or two to see if folks drop any questions in the chat here. Okay, I'm seeing things like language, vaccination status. Those are two really important ones. Anything else folks are seeing? Lingering need to socially distance and vaccination status, right? Those are kind of some of the key things, I think. I mean, folks are still thinking about socially distancing themselves to keep themselves and their families safe. Next slide. But one of the things that I'd like to kind of counter, not necessarily what folks are saying, but I want to counter some of the narrative that we have around this. When the pandemic started and we were starting to think of the strategies for keeping people safe, a lot of the conversation centered around physical, social distancing. But I want to counter that and say that a lot of folks in public health were saying, it's not really about being socially distanced, it's about being physically distanced. That's really what we're talking about. Because when we start talking about it as being socially distant from one another, that carries with it the connotation that we can't connect with each other in other ways that we're able to. And I think it's really important for us to make that distinction, that we can have physical distance from each other, but still be connected socially in some way through internet, through Wi-Fi connections and Zoom, through writing letters with each other, picking up the phone and talking to folks. All of those things are the things that are really important. It's really important for us to maintain connection, to be able to seek support from each other, to share resources, to listen to each other when we're having challenges, and to have compassion with one another. Next slide. Another question I kind of want to quickly pose in the chat and see if anybody has any reactions to. How did you remain connected to others during the pandemic? Or how are you continuing to remain connected to others during the pandemic? Let's see if we're getting any responses in the chat here. Having more chat and email. I know for me at least, my texting has kind of gone through the roof, especially when it comes to sharing funny memes or GIFs or other things to kind of help keep folks laughing during this time. Zoom, WhatsApp, people doing virtual board game nights, calls and chats, all really important. I actually found myself during the pandemic having more connection with folks that I hadn't even been connecting to as much before the pandemic, which I felt was really, really important, and really helped people to stay connected to each other. So all of that to say, it's really important to kind of maintain that connection to everything that we're trying to do in our communities. Next slide. A couple of years ago, Prevention Institute started working with another national organization called Healthy Places by Design, who was pulling together a network of partners to have conversations around this growing crisis around social isolation. So we pulled together this learning network, and started having conversations about what the challenges are that we're seeing related to people being isolated, especially in light of the pandemic. What are some of the opportunities we're seeing to try to improve opportunities for people to connect to each other? And a lot of that went into the development of this report, which you'll see here on the screen, called Socially Connected Communities, Solutions for Social Isolation. It was really important for us to put the focus on socially connected communities and not put the focus on social isolation, because we really wanted to focus on the solutions and the strengths and assets that are already in our communities. One of the principles that really guided the development of the content of this report is kind of having that assets-based approach. We know that folks in communities were doing innovative things to stay connected to each other and to stay connected to community members that might be dealing with that kind of isolation, whether it's because of language, the pandemic, fear of the pandemic. There were a lot of folks that were doing a lot of innovative work out there, and we wanted to make sure that we were capturing that in this report. Next slide. And one of the things that was really important for us to highlight again, and we talked about this briefly already, is really highlight who it was that was feeling this increase in social isolation. So as we mentioned before, it's new mothers and those with young children, LGBTQ and other at-risk youth, recent immigrants and refugees who might be dealing with not only language barriers, but also barriers to understanding the systems here and getting to know people. Older adults who might be isolated because of health or because they might not be living at home anymore. Those re-entering society after being incarcerated, who face huge barriers in terms of their ability to find safe, affordable places to live or to be able to access job opportunities. Folks living in rural communities, not only because they face much higher barriers in terms of broadband access, but also because of the physical distance between them and their neighbors and resources that could help support their health and well-being. And also patients and their caregivers who, because of an increased need to protect them because of the pandemic and other challenges, are facing increased rates of social isolation. So I invite you to, in the chat, as we kind of move forward with the presentation, take a bit of time to really kind of to think about if there are any other communities you can think of that experience social isolation at those high rates. Next slide. One of the other things that, and I'm going to expound here for a little bit, and those that know me know that I love to expound and go off on tangents. One of the things that became really clear as we were doing this project, hearing about the work that other people were doing in communities and hearing about the communities that were dealing with increased rates of social isolation, is we kind of had this realization that social isolation is not a personal choice. People would not intentionally choose to be isolated in their communities. And it also is not an individual problem. It's a problem and it's a challenge that is rooted in community design, social norms, and systemic injustices. And this kind of means a couple of different things that I'm gonna talk about. When we think about things like, I'm gonna take a couple of examples from a couple of the systems around us that are there to, on the one hand, support us, but on the other hand, can really kind of create barriers and end up creating harm in our communities. Things like our education system. Our education system has done a lot to increase rates of social isolation. For example, students of color, especially Black and brown young men, continue to face high rates of racial bias in school discipline. And I know that's not a surprise to folks, but when you start connecting that to things like social isolation, that bias in terms of school discipline isolates them in increasing numbers through disproportionate levels of suspension, expulsion, or removal from the classroom, which not only isolates them from other folks, their peers, fellow students, their friends, but also isolates them from opportunity. We talked a little bit about internet access. There are approximately, the latest studies show 19 million people in America that have no access to broadband service at a functioning speed. And nearly 1 in 4 people living in rural areas and nearly 1 in 3 people living in tribal areas lack that kind of broadband access. And this digital divide really exacerbates disparities related to education, jobs, healthcare, and just the ability to connect to each other. Taking the system of housing and the housing market, public policies that have been in place for many, many years, such as redlining, have created racially segregated neighborhoods, isolating students of color in poverty concentrated schools and producing extreme wealth disparities as well. And the US is also a country that passes laws that make homelessness and poverty a crime, resulting in the forced removal of people from public spaces and further isolating them from peers, from folks that they may know, from services, and from other opportunities. Public spaces. Buildings and public spaces are often really inaccessible for people with disabilities, making their participation in public life difficult or nearly impossible. Another thing that is something that was increasingly in the public consciousness over the last couple of years is that some public spaces display historical symbols, and I'll just go ahead and say they display, Confederate symbols that are extremely harmful for folks in communities, especially communities of color. And that creates harm, creates distrust in those public spaces, makes people feel like they don't belong in those places. And that's something also really important to consider, because that drives isolation for those populations and those communities. I'll just do 1 or 2 more of these, and then we'll move on to some of the recommendations. Our transportation system. So the development of the interstate highway system in the 50s and 60s intentionally split communities of color, resulting in a legacy of severed social networks. It increased pollution in some neighborhoods, and it really cut people off from opportunity in lots of different ways. A lot of the focus then ended up going to the suburbs, where the white majority ended up moving. So it's really important to think critically about our transportation system. Our justice system. We've often talked about the overcriminalization of Black and brown men in this country, and the folks that end up being incarcerated at those levels. They're warehoused in cramped, unhealthy spaces that lack natural light, fresh air, healthy food, and that are far removed from their loved ones and their communities. And that really drives poor mental health outcomes for those folks. And then, like I mentioned earlier, formerly incarcerated people also experience significant barriers to opportunities such as education, housing, jobs, that would have the potential to strengthen their social connections. So when you really think about isolation from folks, isolation from opportunity, and you take this kind of analysis and place it on all of the systems around us that are there to either support, that are supposed to be there to support us and help us live full lives, you can really take this analysis of social isolation and apply it to those. And you can apply it to all the ones that I didn't even mention. I didn't really even talk about our law enforcement and criminal justice system. I didn't talk about our immigration system. There's lots of different places where you just take a look at it and see, how is this system working to kind of keep people isolated and not able to connect to each other or to opportunities. So all of that to just lay the foundation that social isolation, again, is not a personal choice. It's not an individual problem, but it's rooted in community design, social norms, and systemic injustices. These are the kinds of things, though, that even though we did not play a role in putting those kinds of systems in place, a lot of those systems were put into place decades and even centuries ago. They're the kinds of things that we as advocates, as local government, as service providers really have a mandate to go in and try to do what we can to try to change those systems, because all of those systems and all of those policies and practices, those are all things that are within our power if we are able to pull together and advocate and build networks and coalitions. We're able to go in and try to change those systems to the degree possible so that we can end up having healthier, equitable outcomes for our community members. So I just kind of want to leave that with folks as we kind of head into talking about some of the recommendations. And those are on the next slide. Thanks, Zach. So we don't necessarily have enough time to go through every single one of these in the detail that I would like, but by pointing out a lot of the barriers that I just went through, hopefully that gives you the ideas of where we need to go to try to address things and try to change things. But the recommendations that we laid out in the Socially Connected Communities paper really kind of run the spectrum of the places where we can intervene to try to improve opportunities for connection. So the first one here is about co-creating inclusive, healthy public places that encourage social interaction. For example, designing safe places for all ages to gather and encouraging intergenerational exchange, developing policies to decriminalize loitering, which are used mostly to remove unhoused folks from public places, and to enable more innovative use of parks and public spaces. One example of that is winterizing our parks. So, for instance, when the weather turns colder in the winter months, making sure that there are heat lamps or fire pits if they're allowable. During the summer months where it's warmer, making sure that there's more shade and more opportunities for people to cool off when they're in outdoor public spaces. The second recommendation is all around transportation. And this is, basically what we can do is we can urge transportation planners and decision makers to prioritize movability with walking and bicycling networks and other supports like transit service, lowering traffic speeds, doing what we can to try to control and improve air quality in certain communities that are inequitably exposed to pollutants, and ensure that those options are well connected to the places and people, that people visit most often. The third recommendation focuses on encouraging local leaders to strengthen and safeguard inclusive, safe, affordable housing through zoning and other design measures that can help residents gather and make those kinds of social connections that are so important. For example, housing first strategies that include wraparound services and supports, co-locating parks with affordable housing wherever possible, and other strategies like that really can try to make our housing options, especially for lower income folks and in communities of color, more open and available for the connection that folks need. The last two recommendations are not focused on specific built environment related strategies like the first three are, but really they are all about addressing the community practices and moving towards social connectedness as a community norm. Things like creating universal broadband access help with that, implementing practices in communities that are culturally relevant, gender inclusive, and that are trauma and resilience informed. And we'll talk a little bit about, we'll share a couple of example projects in the next couple of slides, just to give you kind of a better idea of what we mean about some of those things. Next slide. So I'm going to take the next couple of minutes to share some examples of projects that we've worked with over the last couple of years that are doing really great work around connecting communities and using that as an opportunity to build capacity and community efficacy, and really shifting those norms toward norms for connecting. And these three projects all come from a project that we managed over the last 5.5 years called Making Connections for Mental Health and Wellbeing Among Men and Boys, which was funded by the Movember Foundation, run by Prevention Institute. And it really was focused around working with communities across the country, primarily coalitions that were working with men and boys of color and military service members and veterans, which are two of the populations in our country that face the highest rates of trauma, face high rates of mental health, poor mental health outcomes. So the first one that I'm going to talk about is work we did with a group called United Women of East Africa Support Team in San Diego, California. And they work primarily with East African refugee communities. San Diego has the second highest number of East African refugees in the country after Minneapolis. And a lot of the young men and boys in that community were feeling socially isolated and were dealing with mental health issues that really weren't recognized and talked about in their community. And when they started this project, the leaders of the organization and the leaders in the community went directly to that population. The population had recently seen a string of deaths by suicide among young men and boys that were part of the refugee population. And they were feeling a lot of hurt. And so what they ended up doing is having these young men lead the charge in identifying what are the community conditions in their neighborhood that are leading to those poor mental health outcomes. And they identified things like a lack of affordable housing, a lack of equitable job opportunities. But above all else, one of the things that they identified was that they lacked a space where they could connect with each other, connect with their culture, and reconnect to their community in a way that would help them heal. A lot of them talked about the fact that in the course of their everyday lives, they had to wear 2 or 3 or 4 different masks in what they were doing. They had to act a certain way at home with their parents. They had to act a certain way at school. They had to act a different way when they were hanging out with their friends outside of school. And that was creating so much tension and stress in their lives. And they just needed a space where they could come together. And so they ended up in the offices of the organization, were able to secure a space that let them have they call it their hub, where they can come together, talk to each other, talk about the challenges that they're facing. And as they were able to build that connection with each other, the organization was able to bring in folks that could help them on other things to try to address some of the other challenges that they were facing. So they brought people in who helped them with interviewing skills and building your resume. They had people come in and help them with public speaking. And then they had people come in and help them to identify how they wanted to address through advocacy the challenges that they were facing around things like a living wage and housing and the fear of displacement and gentrification. And so they ended up building up these young men, building their community efficacy to be strong advocates for their community. And it really culminated in them taking a really strong stance against the racially motivated violence they were seeing in their community, and being really actively engaged in a lot of the protest marches that they were seeing, that were bubbling up in San Diego. So next slide, another example from the project that we've worked on, Making Connections. We worked with a group out of Kankakee Community College in Illinois. It's about an hour and a half south of Chicago. And it's a community college that has a high number of student veterans. And they really saw that they were not having the same opportunities to connect with each other as other folks on campus were. And a lot of that was due to their experiences in the military, high rates of trauma, and just other poor mental health outcomes that they were dealing with. And one of the things that they wanted to do was make sure that they had a student veteran center on campus that was really built to meet their needs in lots of different ways. One of the examples is they, as they were starting to build out the ideas around a student veteran center on campus, they went around and visited other student vet centers at other community colleges in Illinois, and saw that there were things about those setups that really did not sit well with them. For instance, because of their training and their experience in the military, a lot of them were really highly sensitized, which is connected to lingering post-traumatic stress disorder. And they saw spaces where things were set up so that folks their backs were facing the doors and the windows in the centers. And every time somebody would walk in, everybody who was in the center who was a veteran would immediately turn around and be on guard to see who it was that was entering the space. And so when they decided to build out the student vet center at Kankakee Community College, they made sure that none of the seating was going to be with their backs facing the doors, so that folks could feel more comfortable being there and have that opportunity to connect with each other without that kind of disruption that would impact them. The final one on the next slide that I'll share, and then I'm going to show a short video and open it up for questions. We worked also with a group in Honolulu in the Kalihi Valley, which is a low-income area in Honolulu. And the community health center there, Kakua Kalihi Valley Comprehensive Family Services, decided that they needed to meet the needs of young men and boys in the community that did not have an outlet or an opportunity or a space for connecting to each other. And so they ended up building out this, the Kalihi Valley Instructional Bike Exchange as part of the community clinic, where the young men could gather and learn skills around building and repairing their bikes. And because this was something that was a really big interest to the young men. And so they built out this center where they could come in and work on these skills around building the bikes and repairing the bikes. And incorporated into that was leadership development training, where they could not only learn how to be leaders among their peers, but among the community. And they could learn how to connect not only to each other, but connect to the land, connect to their culture, and connect to their communities. And as a reward for going through that leadership development training, each of the young men would get for free the bike that they had been working on as well. And by going through that kind of leadership training, these young men were also able to build their capacity, build their efficacy to be strong advocates as well, so that they could start advocating to their elected officials around things that would help to improve connection for themselves, like an increase in the number of bike lanes and other opportunities in public spaces for them to be able to connect. So that's just to give folks kind of a snapshot of some of the work that people have done to improve opportunities for connection in their communities, and really kind of build that strength and opportunity in them. So moving on to the next slide, I'm going to show just a quick 3-minute video that talks about the importance of building socially connected communities and why it's important for health and mental health and well-being. And then we'll open it up for a couple of quick questions before we wrap up. Great, thanks. So here is my contact information and my email address if folks would like to continue having a conversation around the importance of connection as a counterbalance to social isolation. I think we've got maybe 7 minutes left if folks have any questions. So I'll ask Will to kind of share any questions that folks might be coming up with.
All right. Thank you so much for that presentation, Ruben. I think just from some of the questions you were posing and the responses in the chat, I can tell this is a topic that is top of mind for a lot of people. And like Ruben was just sharing, we have a few minutes, I'll say about 4 minutes for questions. So if you'd like, you can drop your question in the Q&A in Whova. And I'm not seeing any just yet, but to get us started, I actually posed a question. I think you addressed this, Ruben, but just thought maybe we could take another couple or a minute here just to understand a little bit more. Why is it important to make a distinction between social isolation and loneliness? And how does this help us create better solutions?
Right. It's a good question. The way that I view it, and the way to kind of simplify things, social connection is more related to what we see and feel as a society or as a community or as a population. So kind of the isolation that is not just about one person who might feel lonely and feel disconnected, but really about taking kind of a more systemic view of things. And that allows us to then look for the systemic or structural solutions for things. If folks are feeling individually lonely or isolated, that's where folks can kind of step in and kind of help that person, connect with that person, make sure that that person feels connected to them. But really, when we're talking about social isolation and social connectedness, we're kind of thinking of more the broader picture, the bigger picture of what we need to do to improve those conditions across communities and across populations.
Definitely. Yeah, I think I've heard that theme come up throughout today's conference, where we're trying to shift blame and action. So we're not changing people, but changing their environments and the policies and opportunities that shape their lives.
Right.
So this is our audience's opportunity to ask our resident expert, Ruben, some questions. So if you have any other questions, we invite you to drop those questions into the Q&A, or any thoughts you may have into the chat. And while we're waiting for those, I will also just go ahead and copy and paste again the general sign-in sheet into the chat, as well as the CEU form for anyone seeking continuing education units, and then a session feedback form as well, which we really, really greatly appreciate any feedback you can share with us.
Great.
So we can hang around a couple more minutes here if there are any more questions. I'm sensing that, Ruben, you just gave such a thorough overview of the topic and helped me deepen my understanding of social isolation, social connection, and what our role in addressing these challenges are to improve well-being. So just wanting to thank you again for your knowledge and insights, and reminding folks that we have a powerful session right after this one called Storying Community Trauma into Community Resiliency in Indigenous Framework. So we invite you to join that one immediately after this one as well, because I think there will be a lot of continued threads between these topics here.
Definitely.
So we have another minute and a half about. We can stick around if anyone else has questions. And we're just really grateful that everyone had an opportunity to join. We dropped some links in the chat, some sign-in sheets, as well as links to the report Ruben was referencing and some of the work that has shaped the report as well. So hopefully you can leave with inspiration and ideas for how to move this work forward in your community. Right.
Thank you. Before I forget, I just wanted to point out, if folks want to share that video that we just shared, because I feel like it helps to kind of make it very clear to folks why it's important to work on social connectedness and what we need to do that. That's available on Prevention Institute's YouTube page. So if you just go to YouTube and search for Prevention Institute, it'll be one of the more recent videos that is up there. I think we only released that video in the last maybe like 3 months. So it should be pretty high up on the list there.
Excellent. And I just dropped it in the chat for anyone who's interested.
Oh, great.
As well.
Thank you.
So I think we're coming up on our last few seconds here. Just one more big round of applause and thank you to Ruben for sharing with us on this topic of socially connected communities. Thank you to you all for joining today, and we look forward to seeing you in the next sessions. All right, everyone. Thanks so much.
Thank you all.